And it brings us to 10 to 9. Now, around 75,000 people who need carers employ their own staff. They're funded by direct payments. This is according to the charity Skills for Care. The equestrian Paralympian Sophie Christensen is one of them. And she's been speaking to our reporter Charlotte Hayward about why she thinks people like her have been forgotten about in this crisis.
I know that this is a new freestyle that Sophie's riding, which was composed especially for London, 2012.
Sophie Christensen has 8 Paralympic gold medals. She won 3 in London in 2012. She also has cerebral palsy, and she uses direct payments for her care.
I live quite a hectic life. I'm a Paralympian and I work in London. I chose direct payment because it's the most flexible form of care that I can get.
Direct payments means Sophie chooses how she spends the money allocated to her to help her live her life, and she chooses to have a carer to fit in with her. Thousands of other people also do the same thing in the UK.
My primary carer has decided to self-isolate herself because her mother is very vulnerable.
Sophie really needs another person to help her. Isolation isn't an option.
So I'm relying on my backup care, and if that falls through, I'm really stuck. There's a feeling of guilt. Are you putting someone else at risk?
Sophie could call her mum and dad to help, but they have to look after their own parents.
You know, my parents are caring for my grandma. I don't want to call my parents to help me if they are then going to put my grandma at risk.
I'm Caroline Christensen, and I'm in the middle of 3 generations with a mum who is 90 with Alzheimer's and a daughter who is 32 with some disabilities.
Caroline's mum, Sheila, is 89 and has Alzheimer's. Sheila lives 3 hours from her family and also uses direct payments for her carers.
She can't really look after herself at all. She can't get up in the morning. She can't wash safely. She can't keep herself clean. She can't cook. There are 3 different carers that go in 4 different times a day. They rang me up yesterday and said that at the end of this week, they were not sure that they could keep going into mums without PPE. They don't have personal protective equipment because there's nobody to give it to them apart from their employer, who is mum, who is nearly 90 with Alzheimer's. So we spent a long time on the internet trying to get hold of it, and you can't get hold of it very quickly at all because stocks have run out for everybody. If the carers all fall sick, then she is entirely alone without a daughter managing to get there.
The problem is, no one really knows how long we'll all have to stay inside our own homes.
If it is a matter of weeks, then we can manage it. If it's a matter of months, I'm not sure mum will come out the other end, I'm going to be honest.
The Department of Health and Social Care says it's working around the clock to give the social care sector the equipment and support to tackle this outbreak. All Sophie says she needs is a bit more information.
We are completely left on our own to employ our carers. COVID-19 has really left everyone feeling a bit uncertain. No one knows what's going on. And for vulnerable people, that is made even worse by the fact that they might not be able to access any care.
That report by Charlotte Hayward.